Yeah, that's a very good question. I think there are two things that would stick out. I think the first is if the patient's spouse or partner is more concerned about the memory of their spouse than they themselves are, that is a red flag. The other red flag is if they are asking repetitive questions or having the same conversations that they had a day or so before, if they're frequently losing things like keys and mobile phones and they have no idea where they've left them, if they're becoming a little bit confused, if they're forgetting things like PIN numbers, if they're getting lost in familiar environments, those are all the sort of red flags that we're dealing with something potentially more serious than just the normal aging. I think the answer is, how long is a piece of string? I think it all depends on the extent and the duration of the memory loss and how it's affecting your activities, your daily, everyday life, whether that's work, family interactions, social interactions. And I would say that if your memory loss is persistent, it's gone on for more than 3 or 4 months, if there's no other alternatively simple explanation, such as being under a lot of stress, if other people are pointing it out to you, and or it's affecting your general daily interactions, then I would seek a medical opinion. A neurologist would be the right person to see. Yes, and that's why I made the point that you should really not rush to seek an opinion until you've ruled out those other rather more mundane things. But I still see a lot of people who are not really aware that it is actually their anxiety and the stress that's going on in their lives that is affecting their memory. Sleep is certainly an important cause, or lack of sleep is an important cause of poor memory. And I think one other thing that I've become more aware of myself is attention deficits can impact memory. And I've certainly seen a couple of patients who have ADHD and nothing wrong with their memory, but whose presenting symptom was the fact they can't seem to remember anything. And that's because of a deficit of attention. They're not focusing on what they're being told, rather than an actual memory problem. So if we're thinking about specifically neurological problems, the most common cause of progressive memory loss is Alzheimer's disease, which is a form of dementia. There are other causes of dementia, but Alzheimer's is by far and away the most common. Vascular disease, so hardening of the arteries in the brain, and much rarer conditions such as brain tumors, conditions called normal pressure hydrocephalus, and other neurological conditions can impact on the memory as well. Yes, so I think the first thing is, let's start with the lifestyle changes. So we've already talked about sleep. So people who are not getting enough sleep, they're very anxious. Sometimes treating that will improve their memory. In terms of treatments for Alzheimer's disease, we have a couple of medications which are sometimes helpful in improving people's memory. And more excitingly, we now have new treatments which are available at Cleveland Clinic London, but which have to be given by regular intravenous infusion, and which target the toxic protein that builds up in the brain of people with Alzheimer's, a protein called amyloid. And this has only been really a treatment which we've been able to offer for less than a year or so. And although it doesn't make your memory better, we know that it does slow down the inevitable decline.